The term evidence-based practice is thrown around a lot these days in nursing class. We're talking about using data to make accurate decisions and evidence-based interventions. We want to give you a complete breakdown of what evidence-based practice is and why it's so important for you to nail this.
The College Disruptor.
You can subscribe, like, and share our videos and be always one step ahead with all the information you need to know during your non-traditional college journey. Obviously, you will learn a lot about EBP during your classes, but after watching this video, you will be one step ahead and know what your professors are talking about. Evidence-based practice, also known as EBP, is important for nurses because it's the underpinning foundation for safe and effective nursing care, because it's a way to ensure that nurses provide care based on the best available evidence and not just on personal opinions and biases. The idea behind this is to abandon outdated care delivery practice or protocols that don't allow you to achieve high healthcare research and quality. The sources supporting EBP decisions must be peer-reviewed, meaning whatever study, article, or journal you decide to present as evidence has to be reviewed by other experts. You can look in well-regarded databases like EBSCO, CIN, AHL, and Medline, or online medical journals like the American Nurse Today. So, is evidence-based practice the same as research? Well, yes and no. EBP involves research, but it is one small part of the entire process, and they both have different purposes. Let me clear it up for you. Research wants to acquire new knowledge or validate existing ones, but EBP, on the other hand, is a consensuous use of the best available evidence gained from the scientific method to make decisions about the benefits and healthcare of patients. We can say that EBP takes a step further than research because it puts all that knowledge into action for health professionals. As you will see in your classes, an EBP on a nursing initiative will need to accomplish some steps to become a reality. You may have a great idea, like improving patients' education about their anxiety in the ER. That's awesome, and it sounds beneficial, but can you prove it? Can you draw on the most up-to-date research and evidence to convince an entire hospital board that it's a good idea? The following are the steps needed to implement evidence-based practice in the workplace and show that your plan will work as an improvement in health. Number 1, identify. As the main thing, you need to find that aspect that needs improvement. You will need to make a peacock question, meaning a question that alludes to the population, intervention, comparison, outcomes, and time applied to your initiative. Number 2, research. Immerse yourself with all the information you can about it. Check for relevant research literature that is peer-reviewed and reliable. Number 3, evaluate. Don't be afraid to start questioning yourself. Are these sources reliable? Do other sources review them? Do they have previous studies? Always look for high-quality information in sources that support your idea. Number 4, choose interventions. For this step, think about the best way to implement your idea and keep tabs on how it develops. See the big picture. Think about nursing improvement, create educational initiatives, and negotiate with stakeholders to get more of a budget. Number 5, reevaluate. You need to check if your initiative was successful. Review data and documents as many times as needed, and include any revisions or changes to summarize the results. Lastly, number 6, disseminate. You're in an enormous work field, so it's probable that others might find your current evidence and results helpful because they're facing the same exact issues. Make sure to add your work to the existing literature in the study subject and promote good practices among your colleagues. Nurses have to make decisions about patient care based on what they know. What if that knowledge is outdated or incorrect? Ponder that question for a second. Nurses need to be able to draw on the most up-to-date research and evidence to make the best decisions about their patients. You have to talk with other people involved, stakeholders who have the influence and authority to approve your initiative's changes. Showing them enough evidence, planning, and compromising with your proposal will make them see that you are taking an effective course of action to deliver the best care possible to others. We hope this video helped you understand more about EBP. If you have more questions related to nursing, you can find these and many other articles on our website. We'll leave the link in the description below. Thank you for watching. Hit that like, share, and subscribe button so you don't miss any more valuable college information. See you next time.